So guys, Martin, TheNurseNinja here, and I'm talking about varicella. So that's varicella or chickenpox, and basically it's an infectious communicable disease. Most of you probably already had it before. Objective signs is headache, malaise, which is irritability and all that, abdominal pain, increased pruritus or itchiness, decreased oral intake, fever, lesions that look like macules or papules. Then they turn into vesicles, which are fluid-filled, and then once they finally go away, they crust over, so you'll see crusts. Risk factors are those people who are immunocompromised, who have crowded living situations, poor sanitation, poor hygiene, or had a recent exposure to a communicable disease. What do we do? In nursing, we actually make sure they have good skin care. We provide them with calamine lotion, keep them cool but not chilled, keep their fingernails short so they don't scratch themselves. It's mainly symptomatic treatment, so you want to maintain airborne, droplet precautions, contact precautions, and change the linens every day. And what else? Basically, you want to provide antihistamine like Benadryl or Atarax, antipyretics, and analgesics, fluids, and nutritional foods. The outcome is we want to relieve them from pruritus or itchiness, keep them free from injury, and prevent the spread of the disease by reducing the transmission risks. Basically, by being careful hand hygiene, teaching the parents to teach their children to cover their mouth and nose whenever they sneeze. And then you want to provide diversional activities. So basically, keep the kid busy, and so they don't focus on how itchy it is. You want to make sure they adhere to any antibiotic or antiviral therapy. So any kind of medication that the doctor gives them, you want to make sure that they stick to that. Teach them good oral hygiene. Tell the school to get the homework for the child. Keep them out of the sun. And keep the lights dim if they become photophobic. Also, you want to teach the parents appropriate dosing methods of acetaminophen. So basically, you know how children's Tylenol comes in different amounts than adults. You want to make sure that the parents know how to, give the child the appropriate dosages, and call the school to make sure that they know that the child is sick, and that they're going to give you the appropriate amount of homework for the kids so they don't fall behind. And that's pretty much what I got. Oh, the potential complications or complications with varicella or chickenpox is Ray's syndrome. Ray's syndrome frequently follows after the flu or varicella, and usually happens because people are using aspirin. So aspirin has a really high chance of giving children Ray's syndrome. If you want to know what Ray's syndrome is, look it up. Okay, thanks. TheNurseNinja out.